No, I'm happy you did.
Okay, thank you.
I'm happy. You're 3 and 3.
For today's Foxy Moms Wellness Wednesday, we're taking a look at the latest technology that dentists use to check your teeth, specifically cameras. Dr. Brittany Massey with Star Ranch Family Dental is here to explain. Good morning.
Good morning.
These are so important. At your practice, you use different types of cameras. There's something called intraoral cameras and then caries detecting cameras, and sometimes they're combined into one, right?
Correct. Yeah.
Why are they so important?
There are a few. The intraoral helps with a lot of different aspects, and it helps the patient understand what the dentist is actually seeing.
So it's kind of like they're able to look on a monitor and see what the dentist is looking at. Because you hear the sounds a lot, and you hear the dentist often describing what it is they're seeing that the problem could be, but being able to see it, you understand better, right?
Right, and it's hard to be able to actually get in the back of the mouth and see what's going on with their teeth. They know something's wrong, but they don't know what. So it helps them see. It helps them understand if there's a cracked tooth. It helps them understand if the crown's not fitting right and why we are recommending certain things.
Okay, so we're getting a live look at the camera. It's very small. Obviously, it's got to go in your mouth. And then you say you can just flip a switch and then it'll change to a different type of lighting, which detects different types of problems.
Exactly.
Correct?
Exactly.
Let's talk about the intraoral camera specifically. I know we have a graphic we can pull up that explains some of the things. You mentioned the cracked teeth. That's a big one, right?
That is a big one.
So you can kind of actually see the little fracture there.
Exactly.
Poor margin, what does that mean?
And that's when your crown doesn't match up with the tooth structure well anymore, and it can cause new decay.
Then there's gum recession, which is a big problem, and even bigger problem, cancerous concerns, right?
Correct.
So what types of things would kind of indicate that?
You can use that as a guideline, so you can take a picture of what you are worried about and then have them come back in a week, and if it's progressed or if it's regressed, depending on what, you can decide if it needs a biopsy.
And this also helps with insurance, right?
It does. It helps the insurance understand that there really was a problem with that tooth.
Let's talk about the caries detector cameras. Now, this is a little bit different because it has to do with the lighting, right?
Correct. It uses a fluorescence technology, and basically what's happening is it's reflecting the dentin and the bacteria that's causing the decay.
Okay.
So sometimes if you aren't allowed to take an x-ray if the patient's pregnant or insurance issues and the patient doesn't want to pay, you can see some things that you might not be able to detect on that x-ray.
And this mainly, I mean, number one is to diagnose decay, right? Because that's what's going to show up on that kind of fluorescent light.
Correct.
And then often it can, for people who can't have x-rays taken, that kind of verifies what you saw on the camera, right?
Right, or if you have a filling that is leaking underneath that you might not know if it's the bond that was used or a cavity. It helps you differentiate the two.
And what do you hear from patients when they're able to see the inside of their mouth up there?
It definitely helps them understand when they get this treatment plan that's necessary to get things done. It helps them understand why.
Interesting. Yeah. Well, I know you have an website up and running now. What is that website? We'll let people know out there.
It's www.kidzsmile.com. It's confusing.
It's confusing, but it's right there. It says Star Ranch Family Dental. Dr. Brittany comes on once a month, and we talk about your family's teeth and how to keep them healthy. So thanks so much. We'll see you next time.
Thank you.
The time now is 7:49. We'll be right back.